Hello, everyone, and welcome to Talk, Listen, Share, an educational wing of the Shays Warriors Life After Cancer. And tonight we have a special guest with us, as well as Marissa, one of our board members, and Shay as well, doing all the background work. And let's jump right into it because we have so much information that is super interesting that we want to get to. So, just a little bit about Shays. Shays Warriors is a 501c3 nonprofit with an all volunteer board of directors that was formed in the Coachella Valley to help our cancer community thrive after treatment is over. The mission of Shays Warriors is to inspire, inform, and empower through health, fitness, and the mind body connection to heal survivors and their families through a national network of support. Our Talk, Listen, Share community was formed as part of our online educational outreach to support each other through survivorship and thrivership. Talk, Listen, Share is hosted by our board members every second and fourth Wednesday of the month by Shay Moraga, our founder, and myself, Dr. Sonia Fung, a naturopathic doctor specializing in integrative cancer care. We look forward to our special guest speakers to broaden our conversations within the cancer healing sphere. And tonight we have a very special presentation with Dr. Cleo. So hi, Dr. Cleo, and our board member Marissa.
Hi.
And Marissa we're going to talk a bit with Dr. Cleo about facial acupuncture, and then Marissa gets to be a demo for really interesting. Yeah, it's going to be super. I'm like super interested. So we will put your information on the. Let's do a little flash right now. This is Dr. Cleo Amelia, Acupuncture and Chinese Medicine. She is located on El Paseo in Palm Desert. Her website is cleoamelia.com. And we will show that again at the end for our listeners and viewers. So at this time, I would like to have Marissa introduce Dr. Cleo.
Thanks, Dr. Fun. Yeah, we're so excited tonight to have Dr. Cleo here with us. I actually searched her out. I know a couple, my sister and also a friend that personally see her and just have amazing things to say about her. And they have, really helped. She has really helped them in their journey. So we're so happy to have her. And like Dr. Fung said, Dr. Cleo owns and operates Cleo Amelia Acupuncture and Chinese Medicine. It's right down on El Paseo. Her space is so beautiful, and you will be able to see it. It is kind of more of a boutique setting, very comfortable. It does not feel like a typical doctor office. It smells wonderful. It has a very inviting space to it. So very, very comfortable and, like I said, inviting. She aspires to educate the community on the benefits of acupuncture and Chinese medicine for everything from chronic health issues to cosmetic concerns. She combines ancient Chinese medical practices with modern research to curate individual treatment plans aimed at optimizing health. And Dr. Cleo's originally from Chicago, actually. She moved here in December of 2020, and it was about a year after she completed her doctoral program in Chicago. And along with her graduate degree, she completed a diplomate in, say the word because I have a hard time with it.
Canonical Chinese medicine. It's a specific style of herbal medicine.
Thank you.
Yeah.
And this specific style of herbalism offers a functional and systematic approach to prescribing herbs based on the unique diagnostic tool of pulse taking. And when we do the live demo, she's going to demonstrate that pulse taking, which I think is really fascinating. So she also holds certifications in facial rejuvenation acupuncture and also microneedling. So we're really excited to hear today what Dr. Cleo has to share, and I'll let you take it from there.
Well, thank you for the beautiful introduction, and thank you for the opportunity to be here from Shays Warriors. Like Marissa has said, I am on this life mission to educate people on the benefits of acupuncture, and I think that's obviously where I'm going to start. A lot of people that I meet just think that acupuncture is good for chronic pain or an acute injury or just pain in general. And, as cliche and kind of cheesy as it sounds, like acupuncture is good for everything. But relating it to post-cancer care or during cancer treatment, I would say that obviously it's great for chronic pain. It's really good for energy levels, fatigue, rebalancing hormones, rebalancing the body, cosmetic concerns, so acne or rosacea or anything like that, digestive health, sleep, and during cancer treatment, it is good for managing any side effects that you are having, like during therapy that you are going through. And I do work alongside other doctors to make sure that you're getting the most quality care that you can get and that we're working together rather than separate from one another. And then touching base just on the vibe that I'm creating here at my clinic, I do want it to be very, non-medical. I want everybody that walks into the door to feel like they're having a very boutique and tranquil and serene experience here. I want you to feel like you're in good hands and taken care of, but then also be provided with, I give all my patients like little homework to do when they leave. So you're being provided with tools outside of here to make better life choices for yourself. So that's just kind of the gist of what I'm trying to create here at Cleo Amelia. And then, I thought I would talk a little bit just about how acupuncture works, because that's another common question that I get. And to be honest, it's a little bit difficult for me to answer because I have in my head, where do I start? You go to school for 4 to 5 years for this. How do you sum that up in a 30-second spiel? I'm not sure. But the basic theories of Chinese medicine can always be brought back to yin and yang. So like Marissa stated, I take more of the functional route of medicine, which would be like the yang route. So I always look at the body and I'm like, okay, what is functioning properly? What is not functioning properly? So yang in your body is function, it's movement, it's warmth, it's heat, it's your metabolism, versus yin, which is substance, like your actual physical body, fluids in the body, things like that. So just looking through the body, looking at the body, looking at disease, looking at pathology, looking at any issue that anybody comes in with through that lens of yin and yang. If you can fix function, if you can rebalance homeostasis in the body, then your substances will follow. So that's basically the functional approach that Marissa was talking about and that I take with my patients down the Chinese medicine route. Chinese medicine also looks at things through a little bit of a different lens in terms of the organs. So we tend to look at organ systems versus like a single organ. Let's take like the spleen, for example. I like to use that one because Western medicine doesn't really talk about the spleen, but in Chinese medicine, it's huge. So obviously you have like the spleen in your body. It's an organ, but in Chinese medicine, we also look at the spleen acupuncture channel. We look at all of the functions of the spleen in Chinese medicine. So it's said to hold the blood. So if it's not holding blood, it causes bleeding. It's said to hold the organs up. So if it's not doing that, it can cause prolapse. So you're looking at these different organ systems and what's out of balance, and then how they're interacting with other organ systems in the body. Is something overbearing? Is something not working hard enough? And just reestablishing that organization in the body. I don't necessarily like to, I was talking to Marissa about this earlier, like put a name to diseases. I think that a lot of people can then sort of like identify themselves as like, oh, I'm autoimmune, or oh, I'm arthritis, or oh, I'm cancer. And I don't necessarily like to put that mental state in people's heads, and neither does Chinese medicine. So we tend to look at things or name things as sort of the imbalance that it is in the body, and then how we can rectify that back to optimal health. So how do we do that? So acupuncture points, they're along acupuncture channels in the body, and the points tend to lie over bundles of nerves. They can be in really electrically excitable parts of muscles. They can be over areas where we say that like chi flows more superficial in the body, like any area in the body where you can readily access the deeper energies in your body is where an acupuncture point can lie. And depending on what you're treating, that will dictate what acupuncture points that you're choosing. So basically you take the acupuncture needle, and when you're sticking it into the acupuncture points, there's a lot of different things that happen in the body, in our system, that you can't see, but you can definitely feel. So you have a release of hormones, a release of neurotransmitters, a release of endorphins that can help with hormone regulation, feel good moods, pain release, things like that. And the idea is you're just stimulating the body's own natural ability to heal itself.
Do you feel it right away?
Yeah.
So it's kind of an instant gratification?
Right. So yeah. So
okay.
When you put a needle into the skin, you definitely want to feel not pain, but sensations. So we call this de qi, like DEQI. So de qi. So when you stick a needle into a person's acupuncture point, they might feel something like buzzing or vibrating, or if you stick it in the hand, it might travel up the arm a bit. Sometimes if it's close to a nerve, you might feel like a little brief electric shock, like whoo, and then it sort of subsides. Nothing should ever feel painful. The sensation around the needle should stay very dull and achy, but you definitely want to feel something, but not pain.
Mm-hmm.
So that's acupuncture in a little few minute gist. Obviously, there's a lot more to it, but just to keep it simple for you guys. I also work extensively with herbal medicine. I did a 2-year program outside of my doctorate degree in a specific style of herbalism that focuses on reestablishing function in the body. So my whole thing. And just like acupuncture points with herbal therapy, I don't use herbal medicine. I don't use single herbs by themselves. Everything always works together. Just like an acupuncture point, I would never do just one acupuncture point. It always has a friend. With herbs, it's the same thing. They always have friends. They're combined together to make a formula. So if one herb is going up, there's something else in the formula to make sure that it's not going too much up. So we're always looking at like the flavors of herbs, balancing out heat and cold, balancing out directionality in the body, always balancing out flavors of herbs. So like you can't just give somebody a bunch of sweet. They won't be able to digest that. You got to give them a little bit of like warmth or pungent or spicy. So you'll notice in your formula, if you ever take a Chinese formula, that has a lot of different flavors to the formula. And then, besides acupuncture and herbal medicine, I also do cupping and gua sha, which I will show when we get to the demo treatment, just what those tools look like. Cupping is the suctioning up of the skin in cups, which I'll show you, and then gua sha is a scraping of the skin. Both create a little micro injury underneath the skin in the blood vessels, which again stimulates the body to heal itself by sending immune cells there, fresh blood there, breaking up any stagnation in the muscles, knots, anything like that to help with pain and circulation and promoting overall blood flow. And then I also do something called moxibustion, which I will again show you in the treatment room. It's the burning of an herb. It's very nourishing for the body. So especially post-cancer care, maybe you feel a little bit dry or lacking of fluids or thirsty or something like that. Moxibustion is a great way to really fire up the body, fire up the systems that help you make more fluids and nourish your substance and nourish your yin. It's very calming for the nervous system. It's burnt over the acupuncture points. So as you're laying on the table, you'll feel the warmth, you'll feel the activation deep within the needle. So it's not just like superficial on the skin, but you feel the heat really penetrating into the skin. And then other than acupuncture and Chinese medicine, I also focus a lot on diet and lifestyle advice and therapy. I work through diet and lifestyle through both the Chinese medical lens and just things that, new modern research has taught us about, our metabolism and what science has provided us about what we can do to better our systems. So I work a lot through constitutional diet therapy, meaning this is a simple way to put it, but if you're hot, eat some cooling foods. If you're cold, eat some warming foods. There's more that goes into it than that, but typical Chinese medical theory bases a lot of things on that. So for example, let's say, you got cold hands and feet and you have a bunch of loose stool and you need to wear a jacket when it's 90 degrees outside, but you're eating cold smoothies every single morning. That's just a simple switch that we can make for you to maybe have some soup for breakfast. So just working on, what's right for you, because that's going to be different for everybody. It's going to be different based on your constitution. It's going to be different based on seasonality. So is it summer? Is it winter? Is it fall? So taking that all into account as well. And then lifestyle things like, what are you doing before you go to sleep? What are you doing when you sit down to eat a meal? What is your relationship with your spouse, your kids, your family? Do you have a support system? That's all things that tie into, how well you're healing and things like that. Also, I'm a big proponent of, nature and sunshine. We live in an amazing place for that. So what's your relationship with nature? What's your relationship with meditation? What's your relationship with exercise and things like that? So yeah. And then from the Western medicine side of it, I do also offer targeted supplementation. So I work with a couple supplementation companies that I can prescribe supplementation through to my patients through. And this can also be honed in by functional lab testing. So I can order functional labs for people if they really want to get into food sensitivities or nutritional imbalances, stool testing, anything like that, just to really get a better picture of what's going on in your body, to not only help you understand from a Western medical lens, but how we can apply that to Chinese medicine and how I can shift my acupuncture and herbal treatment to better suit what's going on with you. Yeah, that's really all I have in terms of acupuncture and herbal medicine. So if there's any questions before we do the demo, we can discuss that.
Is there any contraindications with post-cancer, things that maybe you wouldn't be able to do, or I don't know, is there anything that, or from a doctor, does there need to be clearance from that, or?
Yeah, I mean, if you are still going through cancer treatment, I would like you to get clearance from your doctor and also to work alongside the doctor, just to be in clear communication about what is what's happening, what is best for your care, and how we can best treat you and help you. There isn't really any contraindications. No, acupuncture can be aggressive if that's what a person needs, or it can also be very gentle, and just straight up relaxing if that's what you need. So I meet each patient there on the table, how they show up and anything that they need, that's what we're going to do. Does acupuncture help with cancer survivors? Yes, so any symptoms that you're experiencing post-cancer, whether it be digestive stuff, skin stuff, emotional health, sleep issues, things like that, we can definitely address those with acupuncture and herbal medicine. And then also, just getting you to a place of optimal health. So how do we prevent that cancer from returning, or how do we prevent any other issues from arising, and just making sure that you're in the best possible health that you can be in from multiple standpoints. Yes, it is. So most of my patients, I would say, the question is a combination of acupuncture and herbal medicine. Is that common? Most of my patients do both. So I would say about 75% of my patients do both acupuncture and herbal medicine. As much as people would like, and as much as I would like my patients to come in every single day, it's not possible, and not financially possible either. So herbal medicine is a great way for you to continue the treatment at home. You can get your acupuncture treatment, and then the herbal therapy is based on the same diagnosis and the same treatment principles that we're doing on the acupuncture table. And you can just take your herbs at home. It's twice a day that you drink it. You drink it like tea, and it just continues treatment, speeds up treatment. I do not take insurance, no, but I can provide my patients with super bills, which you can submit to insurance for reimbursement.
Doesn't seem like we have any more questions. So
yeah,
how do we feel about doing the demo?
Yeah. I think we should, let's move on to the demo, and we'll get some more questions later.
Okay, so we're gonna move down the hallway, and maybe you can share your beautiful space. And I'll make my way to the room.
Are you filming me?
Yep.
Okay, this is my lobby. We were sitting in two chairs in the back of the lobby here. Me and Marissa were always got some essential oils going, dim lighting. And then this is down the hallway. I have 4 treatment rooms. I also have a massage therapist who does massages out of here in this first room. I work out of 2 treatment rooms. I have a talk therapist that also works out of one of the rooms as well. So if you need talk therapy or massage therapy, you can get those. I'm big into skincare. I do cosmetic acupuncture as well, and microneedling. So these are some skincare products that I sell. This is one of my treatment rooms here. And Marissa's ready. I'm ready. And then this is my main treatment room back here. So for Marissa, I created a fake case for her just so we have something to work off of. So all of the symptoms that I'm going to be stating for Marissa are not real. They're something that I made up, but they are quite common in people and post-cancer patients. So I just thought I would give kind of a well-rounded example of what somebody might come in for. So Marissa's a 29-year-old female. She's coming in for acid reflux, nausea, nasal congestion, watery, loose bowel movements, insomnia, night sweats, a lot of acne along the jawline as well due to some hormonal imbalances that she's having. When she first came in, for the treatment, she sat in the chair over there and we had a full medical intake and history where she told me everything. She told me all of these symptoms that she was having and we discussed everything. I asked a lot of questions during the intake, which may seem unrelated, but again, we're drawing in everything from the body, painting together a whole picture of the body. So now that Marissa has told me everything, we have some other things to Marissa. She has some diet irregularities. So you eat a lot of dairy.
Yes.
Yeah, a lot of cheese.
A lot of yogurt.
Like and raw salads.
Raw salads?
Yes.
Mm-hmm.
Okay. Okay. Oh, and spicy foods.
Yeah,
and you eat pretty late, like close to midnight.
Yeah.
Yeah, okay.
TV watching.
Yeah. And
eating late.
Can't fall asleep. Mm-hmm. She binge watches crime shows right before she goes to bed as well. And then while she's watching this crime show, she scrolls through crime Instagram pages about crime.
Mm-hmm.
And then she has really vivid dreams at nighttime. She also has some neck pain in the upper back and the shoulder, and neck pain due to sitting at a computer all day for her work. But her main complaints right now are the digestive system, the insomnia, and the acne. So I'm going to take Marissa's pulse. I'm just going to explain a little bit of pulse diagnosis. So Marissa, can you uncross your legs for me? Thank you. And then I'm going to put this up here. You're going to put your hands on here. Okay, and then position the back of the hand like this. So Chinese medicine pulse taking, I get a lot of information about what's going on in the body and the organ systems through the pulse. I base my diagnosis off of this, what she's telling me, the questions I asked, the answers she's gave, and then this also corresponds to the herbal formula that I would be giving her. So there's 3 different positions on both of the wrists, and I'm feeling for the quality of the pulse. Is it wiry? Is it tight? Is it fast? Is it slow? Is it unsmooth, like bumpy? Is it slippery, like sliding like a pearl across my fingers? That's all indicating different things in Chinese medicine and different qualities of the organ systems. And then I would feel the other side as well. So basically the first finger corresponds to the upper body, middle finger corresponds to the middle, and then lower corresponds to the lower body. The left side is more yang, so more function, what's going on with function in the body. The right side is more substance, what's going on with material in the body. So great, so off of Marissa's pulse and what she's telling me from her signs and symptoms, as I spoke to earlier, there's a little bit of an imbalance in the system. I'm finding too much heat in her stomach, but she's got a cold spleen. So we're gonna cool down her stomach and we're gonna warm up her spleen. Some diet suggestions that I would give her is maybe cut out the dairy a little bit just to help with the acne and the nasal congestion, and then also switch over to lightly cooked foods and soups to balance out the cold in the spleen that we were talking about. So like no raw cold salads, but she also doesn't want to eat too spicy because she does have a little bit of heat in the stomach. So just constitutional eating for you. Okay. And then maybe before bed we could switch to something more light, like a Seinfeld episode versus crime shows. We could do that. Even watching TV at night, it might be helpful to wear like blue light glasses just to help with the sleep and the insomnia. Okay. So I'm going to have you lay on the bed. Okay. So typically Marissa's shoes would be off, but for the demo, we'll just leave them on. And I'm just going to demo a few acupuncture points. So you'll get probably much more acupuncture than what you see here, but just for the sake of the demo, I will pick a few points. I'm going to have you rest your arms down to your side. Are you comfortable? Mm-hmm. Okay, great. So first thing I'm going to do is kind of palpate some of the channels that I think are involved. So on the hand here, this is the large intestine channel. Maybe I'm feeling for some discrepancies in the channel that can be like bumps or indentations. Like she has a pretty big indentation here along the large intestine channel, or any like soreness by the elbow there, indicating some large intestine involvement. And then I would also palpate like the spleen channels of the inside edge of the foot here, and then up the leg, and then the stomach channel that's running down the outside of the leg. And again, just feeling for anything that feels rough or unsmooth or bumpy or anything like that. And then kind of guiding my acupuncture treatment based on acupuncture point function, but also what I'm finding when I feel her actual body. So listening to the body and then going from there. All right. So Marissa has never gotten acupuncture before. So we're going to take it nice and light. So usually for a lot of people that experience insomnia, anxiety, or even first-time acupuncture patients that may be a little bit nervous, I like to start with some acupuncture in the ear. It's very calming to the nervous system, helps with palpitations, anxiety, and sleep, and helps her calm down on the table. So I'm just going to start in your right ear here. And these are just little tiny baby needles that go into the ear. So you probably can't even barely see it there. That's it.
Fun.
All right, and we'll add one more in the ear. So that's a point that helps calm the heart. And this is a point that helps calm the nervous system. And you may have noticed that Marissa's stomach started to growl a little bit. That's totally normal on the acupuncture table. It means that your body is going into rest and digest. So it's a good sign.
Okay.
So then I'm going to get out a little bit of a heftier needle.
Okay.
So these are the typical size needles that I'd use on the body and in acupuncture. So I can hold one up to the camera. As you can see, it's longer than the ear ones. It's a little bit thicker. But again, it shouldn't feel painful or anything like that. And I also use something called a guide tube with the needles. So it's just a plastic tube. It goes around the needle like this, and allows for a nice, easier insertion into the skin. So I'm going to start here on the hand. This is large intestine 4. It's a pretty strong point at creating more energy in the body if you're feeling fatigued, and just also helping with overall digestion. Are you ready?
I'm ready.
So take a deep breath in and out. See?
Yeah, you don't.
You feel it,
I
but
was
it's not
nervous
pain,
about that.
right?
No, not at all.
A gentleman named Gabriel Rivera said, "I'm in love with the model."
That would be my husband.
So again, for the acupuncture points, we're always pairing them together. So large intestine 4, I pair it commonly with a point on the foot called liver 3. But since I don't have access to her feet, I'm going to choose a point on her stomach, because the large intestine and the stomach, both digestive organs, both work really well together. So we'll choose one on the lower leg, maybe where I feel like an indentation, maybe around stomach. 39 or so. This happens to be something called a lower Hussey point of the small intestine. So now we got large intestine, stomach, small intestine, working on the whole digestive tract there. So large intestine, stomach are yang organs in Chinese medicine. So we got 2 yang organs going, and then I'll start to work on the yin organs a little bit. So let's focus on the yin organs here on the left side. So I'm going to choose some lung points, because those pair really well with the spleen, actually. They're friends in Chinese medicine. So I'm going to choose a lung point that helps with fluid metabolism. So this one close to the wrist here, and I just pinch up the skin to help it be a little smoother. That's it.
Now, tell again what the spleen is. I'm so bad with all the parts of the body, but the spleen, and this may be a stupid question, but
Yeah.
because you speak a lot about that functionality of that.
Yeah, so the spleen is the spleen itself, but then also it has a lot of different functions in Chinese medicine, including a lot of involvement in the blood. So it can take your food, turn it into nutritious substance of the blood, and then transport all of that nutritious substance to nourishing the muscles, nourishing the flesh, creating your body. And then also holding the blood in the blood vessels. So if you have, let's say, really heavy menstruation or any sort of bleeding disorders where you're bruising a lot or bleeding, nosebleeds, anything like that, the spleen has a problem with holding the blood in the blood vessels. And again, this is from a Chinese medicine lens, not a Western medicine lens.
Right.
It has every organ has an action of moving up or down. The spleen has an action of moving up. So anytime we look at prolapse, which is a problem of your muscles, again related to the spleen, moving downward, you want to think of the spleen system not being able to lift up, right?
Interesting.
So we got a lung point over there helping with some fluid metabolism. She does have those watery stools, so we just want to make sure that her fluids are in the proper place. And then we'll choose a point on the spleen channel. Spleen 6 is a nice point here. This just helps with a lot of menstrual irregularities as well, and just overall nourishing to the spleen system. How do those feel, Marissa?
I mean, like the ones on the legs, you feel a little bit more, but it's more just like pressure.
Yeah, like a dull ache.
Yeah.
So now since Marissa does experience some acne, I'm gonna give her a little facial acupuncture as well. Just 2 points. And this will also help with some nasal congestion that she's having. So it's just a point right beside the nose here that opens up the nasal passages. This is on the large intestine channel too, so it goes to the face. So it's all connected, as you can see, tied in with the other points that we've already done on the body. These are much thinner needles, and they're coated. So they're a little bit smoother insertion, minimizing.
Feel it a little bit. But
minimizing bruising in the face. I use these for cosmetic acupuncture as well, filling fine lines and wrinkles with them, promoting collagen, lifting the face, making sure all the muscles of the face are working properly. And that's that. That's Marissa's acupuncture treatment. Now, if she, let's say in a couple of treatments, she came back and she's like, oh my gosh, my digestive symptoms are gone. I'm sleeping way better. I just really have this like chronic neck pain and back pain. We might switch the treatment to some cupping. So I can show you guys a cup. So this is a cupping set. These are the cups. They're applied to the skin via this gun here on the back, and then I kind of move them around in the muscles and just breaking up any stagnation there. And then the gua sha I was talking about is this spoon, actually. So it's a soup spoon. It's really nice, like on the back of the neck here, opening up the back of the neck, helping with headaches or neck pain or anything like that. The facial acupuncture treatments, you got a full cupping and gua sha treatment on the face. So this is a facial cup, much smaller. It's glass, doesn't suction as much, doesn't leave any marks. And then this is a facial gua sha stone. So that's included in cosmetic acupuncture. Yeah. Oh, and then the moxibustion. So maybe since Marissa's spleen is feeling a little bit, weak or cold, we might do some moxa on her. I tend to use these sticks of moxa. They're smokeless. They smell less. Oopsie, that's okay. They're more tolerable than the moxa that I'll show you next. So I just light the moxa stick and then I would hold it over some of the points like so. And it's really relaxing and stimulating to the acupuncture points.
Does it have a smell?
It does a little bit, yeah. So I'll let you smell the real moxa. So that's smokeless moxa rolled into a cigar-like stick. This is moxa punk. So this is moxa that I would take. It's like really fluffy. So I'd take this, I'd form it into like a little cone or a ball, and then I might apply it like, it takes some practice to form balls, but see, over the acupuncture points or needles, and then light that. And I'd obviously have a barrier between here and the skin so that if anything fell, it wouldn't burn her. This is much more smoky and smelly. So if you want to still smell it. Yeah,
I still smell your like beautiful scent of your place.
You can smell this one. This one kind of smells like.
Oh yeah.
Yeah.
I want to smell.
You want to smell?
Yeah.
And then this one.
Yeah, that
When
one I
it's
don't
burned,
smell.
it smells much stronger. All right, and then Marissa's gonna go home with some herbs. Her herbal formula is gonna have about 7 or 8 different herbs in it, all which are doing different things to help her rebalance. But I just wanted to show one of the herbs that would be in her formula, which is ginger. This is a common herb, that's why I'm showing it. But, the complicated part of Chinese medicine is there's 3 different gingers. What ginger do we choose? They're all processed in a different way, and they all have different functions. This ginger is better for like loose, watery stools, and more like warming of the limbs, I would say. So more superficial warming of the limbs. This is strictly, the dried ginger is strictly for digestive issues, and warming more internally. And then if she had any bleeding, maybe let's say in the digestive tract, like a diverticulitis, ulcerative colitis, or anything like that, I would use blast fried ginger. So it's a charred ginger to stop bleeding. So yeah. And if you want to take a look inside, they're just little granules that you mix in hot water and you drink them like a tea.
So it's not pills.
No, not pills. It's a little tea mixture.
Someone asks, how long can an acupuncture needle stay in the skin?
Well, how long can it stay in the skin? I don't know the definite answer on that, but I leave the needles in for about 30 minutes. And then you rest for the 30 minutes and then I take them out. But I mean, they could stay in for hours. With more severe cases, like let's say somebody has like some paralysis down their lower limbs or neuropathy in their feet, the needles might stay in longer, and I might apply these cords always get tangled up, but this is an electrostimulation machine. As you can see, it has little leads on the end of it that attach to the needles, which stimulate the needles more to help with feeling, like nerve sensation.
And speaking of neuropathy, because there's a lot of cancer patients and survivors that have neuropathy.
Yeah.
Tell us a little bit about that and how that acupuncture would help.
Yeah, so as I stick the acupuncture needles in, I'm trying to access the nerves. I tend to go more over nerve bundles. So let's say you're having problems with the feet. I might needle a couple neuropathy in the feet. I might needle some nerve bundles that are over towards the back of the knee or up towards the knee a little bit. And then I would add the electrostimulation to it, which just fires up the nerves, signaling the body, like, let's heal these nerves, let's get more feeling there, let's, get a giant rush of blood flow to that area.
Awesome.
Yeah.
Another viewer says, what are some typical packages you have?
For acupuncture, I think that's what they're referring to.
I think so.
Sure. So a 6-pack of acupuncture, that's 6 acupuncture treatments. It's $570. So that brings down the price of the first treatment, which is $130 to $95, and then every other treatment is $95.
Sounds very affordable.
Mm-hmm.
Yeah.
Another viewer says, I need to work on my health, get my hormones in check, and maybe a little facial acupuncture treatment. Great job, ladies. This is great information. How does this help balance hormones out?
Yeah, so as you stick the needles into the acupuncture points, you're stimulating hormones already, and your body has an amazing ability to heal. Like, your body knows what to do. If you stick an acupuncture needle into the body, like, acupuncture points have a lot of different functions. What your body needs, it'll take. So as you rebalance each of the organ systems, your hormones will naturally rebalance. And that's really why I'm about promoting functionality in the system. Because if everything is functioning smoothly, like your thyroid is working normally, your kidneys are working great, your endocrine glands are working amazing, you have great brain health, great digestion, your hormones will naturally come back into balance. Same thing with, like, if you're doing things at home to naturally balance stress levels, and you're not watching crime shows at 1 a.m. And then can't sleep. So just working on everything. It all goes into play. It's not one hormone. It's not one area.
How about hair? Does acupuncture help with hair growth?
It does help with hair growth, just again by promoting overall health, but I can also do stuff in the scalp to promote hair growth by sticking some needles in the scalp, and then also doing micro needling, which is a more intense treatment for hair rejuvenation.
And is that good for both men and women? And
Yeah.
what are the results typically? How many sessions do you need?
So I would say that the results are better with microneedling. I numb the scalp. It's a more kind of invasive treatment, if you will. And I would say starting off with 8 monthly treatments would be a good place to start for the hair rejuvenation.
Awesome. Great. How does what you do relate to circulation?
Yeah, so I mean, acupuncture in itself, just sticking one needle into the skin, doesn't even matter if it's on an acupuncture channel or not, is promoting more circulation in the body by creating a micro injury underneath the skin. So by sticking the needle in and signaling the body like, hey, there's a needle in my skin, your body is gonna automatically send more supplies there, whether that be blood, immune cells, and just creating an overall response. So even if it's the wrong acupuncture point, I could do a treatment that, doesn't make any sense for Marissa, and she would still get benefit out of it because it's promoting circulation.
Back to the hair loss. Is there a difference between general hair loss versus hair loss post chemo?
There is, because there's many different reasons for hair loss. Like you can lose your hair because of old age. You could lose your hair because, you have a hormonal imbalance. You could lose your hair because you went through chemotherapy. But I think at the end of the day, it all stems down to like other things that are going on. We have to treat you and we have to fix your overall health first, and then the hair will come, if that makes sense. So if somebody walks into the door and they're like, oh, I want to work on hair growth, but I have really high blood pressure. I haven't pooped in a week, and my ankle is 2 times the size because it's swollen. Do you think I'm going to start with treating their hair? Probably not. So we have to address some other issues first, and maybe your hair will come back after you regain some health and things are more realigned. And if it doesn't, then we can kind of address the microneedling side of things.
Trust the process.
Yeah. Mm-hmm. Yeah, and it is a process. Like I like to be realistic with my patients. I do suggest that they come once a week for 4 to 6 weeks. And then you can start to space things out if you are seeing improvement. But I have had people that have been coming to me for almost a year and they still love to come every week. All right, Marissa, you ready for your needles to come out?
Sure.
So Marissa's rested for 30 minutes. We'll take her needles out. I always start from top to bottom with the needles, just because in this day and age, we have a lot of energy in our heads. So I want to pull that down. Again, also calming the body and the nervous system as we do that. And you may notice that she bled a little bit out of that one towards her nose. Totally common to bleed from acupuncture points. It's like literally a dot. But, you just dab it off and it's gone. And that's that.
Okay.
How are you feeling?
Good.
Renewed?
Yes. I'm ready to come back.
Good.
Yeah, it was great. I mean, even what you did, you could kind of feel
Some sensation.
a little something.
Yeah.
Mhm.
There you go. All right, Marissa, you are free to go. Your
Thank
herbs
you.
are up front, and I will see
Okay.
you next week, okay?
Sounds great.
If you need any new show recommendations, let me know.
I'll stay away from the crying.
Yeah. Thank you.
You guys have been awesome tonight. Thank you so much.
Yeah, thank you.
Thank you.
Oh, and say how your working hours, Monday through
Friday, and then Sunday.
so weekends.
Nice. This was so fun, and thank you so much for doing the demo and talking about acupuncture. Definitely want to mention that that we are live for Talk Listen Share every second and fourth Wednesday of the month at 6 o'clock, and we are also. I want to note that Shays Warriors is partnering with the Gardens of El Paseo and their concert series. That's going to be this Saturday, as well as the Tour de Palm Springs this Saturday morning. So the concert series, we will be. It will be with. Oh my goodness, what is his name?
Evan Trey.
Evan Trey, thank you. I always forget.
Sonia, I hate to interrupt and pop in here, but I'm so excited. I was in the background watching this whole thing.
Yeah.
What cool stuff about acupuncture, huh?
Right?
How it relates.
Yeah.
I've always been kind of nervous to do it, but like I think I might go try.
Yeah, definitely don't be nervous about it. I think a lot of people have like a fear of needles, and these are so different from what you would expect. Like with a typical injection, because these are very, very, very fine needles.
Oh yeah, you
and
saw Marissa
doesn't-
didn't even. She looked so
yeah.
relaxed. It didn't look like she was at all in pain or anything. So
No.
that's really cool. And I also wanted to help. I heard you say something about the gardens at El Paseo this weekend. I think the thing that's so awesome about that, it's like the perfect date night, or it can be for anybody, but like beautiful at night, live music, which we definitely don't have enough of in the desert. And then how exciting to be able to be out there. And you guys realize that it is February. The rest of the world, it's like 10 below zero. And we get to sit outside. And I even heard there's wine or soda, or you can just have water, but they have wine available to sit out and listen to live music on the gardens. In such a beautiful place. I'm excited, and benefits Shays Warriors, all the ticket sales. So I think what an awesome opportunity for all the supporters to be there, and anybody that's listening. I know I'm going to be there.
Yep. I'll be there too. It starts at 6 o'clock.
Absolutely. Yep.
All right.
There, I think doors open as early as 4:30 if you just want to go loiter on the lawn. All right. I'll let you close it out, Sonia. What an awesome opportunity, and what an awesome Talk, Listen, and Share tonight.
Absolutely. And we will be having our next Talk, Listen, Share in 2 weeks. And that will be a special event. It's a musical meditation by another guest speaker, Jess Rosenberg. And that's on the 23rd of this month at our 6 o'clock time frame. And thank you again so much for everyone who joined us tonight to learn about more about acupuncture and everything that it can help you with, especially for our cancer survivors out there. So thank you, and we will see you next week.